Cardiovascular Assessment. Cardiovascular assessment is conducted in a range of circumstances varying from physical assessments during routine admission to monitor a patient's cardiovascular status. Preparation. Equipment required: sphygmomanometer, stethoscope, and a watch with a second hand. Hand hygiene. Always practice hand hygiene to limit the spread of microorganisms to help avoid cross-contamination or infections. Introduction to the patient. Introduce yourself to the patient. This can reassure them that they are being assessed by a qualified professional. Confirm the patient's details such as their name and date of birth. This can assist to confirm the identity of whom you are assessing. Explain the examination process. Empowering the patient with the knowledge of the assessment will put them at ease throughout the process. If the patient is stressed or anxious, this may affect their heart rate and blood pressure. Ask if the patient has any pain anywhere else before you begin. Position the patient. The supine position is best suited for assessing the anterior chest. This position is best for inspection, palpation, and auscultation, and is usually the most comfortable. The supine position is when the patient is lying with their face up. Head and shoulders may be slightly raised up to 45 degrees. Cardiovascular history. Obtaining a cardiovascular history from the patient is imperative in the cardiovascular assessment process. A complete cardiac history involves questions such as chest pain, palpitations, family history of cardiac issues, smoking, sleep difficulties, current medication, weight, and any chronic medical conditions. Inspection. Anterior chest. Inspect chest for any scars, deformities, or visible pulsations. Neck. Observe for any visible palpitations. Skin. The temperature, the turgor, and if there is any excessive sweating. Pulse and blood pressure. Pulse. Assess rate and rhythm of the pulse. Both are characteristics that can offer insight into the cardiac output and stroke volume. Blood pressure. Measure blood pressure and document any abnormalities such as hypertension or hypotension. Changes of blood pressure can be indicators of changes in cardio output affecting oxygen-reaching cells. Palpation. Palpation involves the use of the hands and fingers to palpate the area surrounding the heart for pulsations. Using the palmar surface of the hand to palpate for thrills or heaves of the cardiac area. Additional palpation may be used to find the exact location and timing in relation to the cardiac cycle. The patient should be in a supine position. Palpation locations. The hands are used to palpate the precordium gently for pulsations, using the palmar surface with the four fingers closely together. Palpation is actioned in a systematic manner with assessment of specific cardiac landmarks: the aortic, pulmonic, tricuspid, and mitral areas and Erb's point. Palpation. Aortic area. Inspection. Anterior chest. Inspect chest for any scar. Palpation. Apical and tricuspid area. Percussion. Percussion refers to the action of tapping on the chest wall with fingers to judge the sounds that reverberate. The sounds to be aware of around the precordial area of the chest are a resonant sound that would indicate normal tissue beneath. Percussion over the lung tissue, the sound will resonate as semi-hollow, flat, or dull in pitch. If the patient is experiencing any discomfort, you can carry on with the auscultation assessment. Auscultation. Auscultation is used to determine the heart sounds caused by closure of the heart valves to assess if conditions are normal or if there has been a deviation. Auscultation is done using a stethoscope to clarify sounds by blocking out extraneous noises. Auscultation locations on the body.